All right. Hi, everybody. Welcome to our November Polite webinar. If you're here with us, shoot us a note in the chat. Tell us where you're joining from. Say hello. And hopefully, we hear from everybody throughout the conversation as well. And so today, just if anybody's joining us for the first time, my name is Sue Tan. I'm one of the co-founders of Polite and very passionate about exploring the education side of what we do, because that's such an important piece of understanding how to use cannabinoids, effectively, efficiently. And so every month we like to bring in a guest expert to help us do a deep dive into a certain aspect of cannabinoids, plant medicine, integrative health, and other topics that our community cares about. And so thank you all so much for joining us today. We have a really important topic as fellow women, with a focus on women's health. And it is such a broad and underserved topic that today we're just going to focus on kind of PMS and menstrual cycle. But in a part two, and maybe even subsequent sessions, we'll focus on things like menopause, perimenopause, postmenopause, because there's so many conditions, issues, needs that we as women face. And so, but we know we want to do justice to getting it to enough detail for different parts of our cycle. So without further ado, I want to introduce Jessica Strufert, our amazing clinical expert cannabinoid therapist. And Jessica, do you want to give a little brief intro of your background?
Sure. So yeah, I'm currently a cannabinoid therapist and educator, but I am a retired respiratory care practitioner. So if you don't know what that is, I worked for 22 years as a respiratory therapist in the emergency room, the ICU, and my specialty was neonatal ICU and peds. So labor and delivery and NICU and pregnant women. So that's a big part. And I was in the ambulance. So let's just say I retired from that, got a little burnt out, but I also ended up hurting my spine from intubating patients, which then led me to cannabinoids. And then I wanted to know everything about cannabinoids and the endocannabinoid system. So I retired from respiratory and just delved into learning and studying everything I could about the endocannabinoid system and how I could take my medical background and start helping other people with cannabinoid therapy and giving more of a quality of life back to my patients. So that's kind of how I've been doing that for the last 7 years now. It's been a while. So I do a lot of conferences for doctors, trying to get them on board of incorporating cannabinoid therapy into their patient care and or just feeling safe with it and being comfortable that if their patients come to them saying I'm using cannabinoids, they don't freak out and kind of go to the stigma place. So big part is just education to multiple healthcare practitioners, and as well as just everybody out there in the public so that they can use it too to benefit their health.
And you also, among the many things you do, you also teach at the Academy of Cannabis Science.
Yes, I do. I actually have a live Q&A tonight for my, I have a course called Pulmonary Dynamics of Vape versus Smoke. So it's just taking my respiratory background, everything I know about the specialty of respiratory therapist is heart and lungs. So cardiopulmonary specialist is what we are. And I took that background and I wanted to teach not just people who know nothing about cannabis, but people that have been smoking cannabis for years, and just teach them how to use it properly, safely, and to the best way to incorporate it into your lungs without hurting your lungs. And as a respiratory therapist, I'm completely fine with you smoking, or I say inhalation method, but there's just a right way to do it. Just like there is with my asthmatics and their inhalers, there's a proper way to use that, just as there's a proper safe way to use your cannabis when you inhale it.
And I think, when we talk about intentional use, it's always about how do you get the most benefit out of it, right?
Exactly.
And minimize all the unwanted side effects. And so since our topic is, and this series is focused on women's health, do women tend to make up, a larger part of your client and patient population, or has it changed over the years? Like, kind of what have you noticed just specifically about women as consumers, users, patients in general over your 7 years of focusing on cannabinoid therapy?
Well, it's less secretive now. I feel like everybody's come out and feels more comfortable talking to other women. I'm a mom of two. The other moms that we're all coming out going, oh, do you use? Oh, you do. And it's, now it's becoming more socially acceptable. You
Out of the
don't feel
closet.
stigmatized or like a bad mom. You're like, it's my health is just as important for my kids to be healthy. So that's what I try to teach. But yes, I do have a lot of female patients. Starting wise, when I first got into it, I focused on oncology. So that's when I realized a lot of female reproductive cancers are treated and respond so differently to cannabinoids than other cancers. So that was another way for me to dive into, well, how are cannabinoids interacting with women versus how they're interacting with everybody else? I mean, we had all these in vitro and in vivo studies because we don't really have human clinical trials, back then really to look at. And it was the mice, the male mice. Okay, now let's start incorporating the female mice and see how they respond to these same tests.
Wow,
And
that's
they
great.
weren't really acknowledging that aspect, just as they do in our normal Western medicine.
Yes.
They don't really dive into the women's reproductive health. We kind of get pushed off. You're stressed. You're not getting enough sleep. Change your diet. Start exercise. They don't always look at us and our individual pains or what's going on. I feel kind of like we get shushed off. So when I started learning about how the endocannabinoid system and those receptors respond so much differently in females versus everybody, the males, that we need to look at that, understand that, so that we can get the most benefit out of our cannabinoids and not actually cause some harm, where we know with some female cancers, THC has to have a specific ratio to be safe. So I'm all about the whole plant. And then I wanted to learn about how it works in the whole body. That means male and female. So
And
just,
yeah, and I think, well, clearly it's time we make a lot more noise because
yeah.
I was even, I didn't realize. I was looking at articles, and in Washington, our home state for you and I,
Mm-hmm.
women are already, a majority of, I guess that's qualified as over 50% of cannabis consumers. And I think it was in, was it Michigan? There were some states where women were already exceeding, and we're the
Mm-hmm.
fastest growing cohort of cannabis users and purchasers. So
Yeah.
I think it just reiterates how behind a lot of the industry and the sciences,
Yeah.
catch up with serving our needs and understanding the unique ways that our bodies and systems process and work with cannabinoids. So today is a small step to remedy that huge knowledge and product gap, and formulation
Yeah.
gap. But yeah, I mean, I was really excited to get to talk to you today because I think this is a topic that so few people have access to real practical experience with, especially in a clinical context. So
Yeah.
it is a big treat and privilege to have you here. Um,
Thank you.
Furthermore, you have experience with a multitude of cannabinoids and cannabinoid profiles. So I
Mm-hmm.
think that's just another layer of detail that a lot of people don't have access to information about.
Yeah.
Um,
Understand the whole plant and the whole body, they work together,
yeah,
just
yeah,
and I think women, we kind of, we have to advocate for ourselves. I think that's why these women are all taking cannabinoids, because you hear it word of mouth and around. We get on things on our own and figure it out. That's how
yeah.
it's been. And I feel that's why women are becoming more dominant in cannabinoid therapy and using
Yeah.
it for their health.
Yeah. So I think in just a sec we'll get into kind of like some of the specific aspects and conditions and things that we need relief from. But on a big picture, I think you and I were talking about how the humans have a long, long history of specifically using cannabinoids for menstrual,
Yes.
pain, cramping, and just reproductive health, right? Even all the
Yeah.
way to childbirth. For those of you that are interested, there's interesting work done by Ethan Russo, who's I guess, broadly published cannabinoid researcher and physician, but he has written some pieces specifically about the history of women in cannabis. So I'll share a link to that later. But just since ancient times, it's already been a remedy, right? And then yesterday we did a post just humorously saying that Queen Victoria used a cannabis tincture specifically throughout much of her adult life to help with menstrual cramping and pain. And so it's no new discovery, but much like cannabis in general, we're almost like back solving from the indigenous, historical, traditional use to the science of it, right? And I think when it comes to the overlap of women's health, and it's no different, right? We're kind of back solving all the ancestral knowledge and use that we kind of already have.
Yeah, we go from anecdotal backwards to the science proving. That's how cannabinoids seem to work.
Yeah. And I think I was looking at pictures like in the 1930s. There were specific patented pharmaceutical tinctures for using cannabis as the main ingredient for period, and menstrual symptoms but obviously that went away when cannabis was criminalized.
Yeah, physicians fought to try to keep it in the pharmacopoeia, and it was politics won. So
yes, which is a whole nother session.
Different session.
Yeah, but all right, just to kind of like lay the foundation for everybody, are there fundamental differences between how male and female systems, I don't know if metabolize is the right word, or process or utilize cannabinoids? Yeah, and I know that's a big question, so you can kind of
it's broad. Yeah, it's a broad question, so you're gonna have to keep me on task here so I don't go off on tangents, because I tend to go all over when I diving in. So yes, women do respond differently to males. So I'm gonna say female and males because it's your physical body. Females respond differently than males, and it happens to do with our hormones and our reproductive system. So women, people will always, I'll have somebody come in and go, well, I'm, a 6'2" male. I can obviously, the little grandma may not be able to handle it, but I can handle it. I'm like, no, actually, you might be on your butt and she'll be fine. It has nothing to do with weight, age, height, or it has to do with your hormones and your body. And again, it's individual. I always tell every person, the endocannabinoid system is very specific to your individual. There's no one size fits all. This isn't a certain medication where I can prescribe it in ml per kilo, off your weight. This is how you respond, how your endocannabinoid takes in the different cannabinoids plus the terpenes. So I talk about the whole plant. I always want to go over the whole plant, but
that's huge. I think there's so much assumption of like size, weight, and you're saying that does not apply.
That does not count. No, it has to do with the individual, their receptors, so it's their tolerance and the diet. Diet plays a lot into how you respond to cannabinoids as well as the cannabinoids, and I'm going to say terpenes again.
Okay.
In you, and that ratio, the ratio of the different cannabinoids. This is not all about THC, CBD, CBC. It's about the whole plant plus all the terpenes and that specific, whatever variation that person is trying. So I always start out with each individual asking them, have they done cannabinoids before? Yes or no? Okay, what did you take and how did you respond? And then we go from there. But females, yes, they respond stronger than males do, and it has to do with our hormones. We diving into the cycle. Our body goes through these hormonal changes monthly, and it's not just that time of the month where you think it's just my cycle. It's the whole month. Your hormones are adjusting to create the environment your body needs if it wants to get pregnant. So that takes a whole month to go through it. And there's these fluctuations of up and down of estrogen and progesterone and prostaglandin and different other hormones. But it has to do with not just the brain, I won't go too far into it, but the hypothalamus pituitary adrenal. There's certain glands or receptors in your body that respond and produce certain hormones or signal the activation. While also in your uterus, there's hormones like estrogen, things being triggered down there. So your whole body is interacting and creating this environment that you would need or require to get pregnant if you wanted to. So this is not just that week year period. This is the whole month and these fluctuations. So a woman's body will respond differently because of those different hormones that are elevated or decreased in her body. She will respond differently to cannabinoids at those different times. So yeah, and we have to be careful because THC with certain receptors and hormones in our body can actually have a negative effect, or can cause certain cells to migrate that we don't want to. So it's just about knowing what's going on with your body, what is it that we're looking at, and then okay, let's find the right cannabinoid, I say profile or cocktail. Some people prefer cannabinoid cocktail specific to their individual needs, which is fine, but it's a profile. It's finding those ratios and those levels of your different cannabinoids and your terpenes and the modality that will work best for that person to keep them in a safe, healthy, get the most potential out of their plant or their product.
Can I ask a question? So just earlier you said women tend to respond stronger. Can you break down what that means? Does that mean that we're more like we can get high easier, that we need less to feel it more? Like what does that mean that our bodies tend to respond
more strong? So different women, again, individual, different parts of the month, depending on your cycle. Not every woman's cycle is the same either, versus how heavy you're bleeding, if you have PMS, whether you don't have PMS, whether your cycle lasts 2 days, 12 days, so there's variations in that. But when this is happening and say estrogen is high, that's when the uterine lining starts to thicken. So estrogen in your body goes up, and that's where women are happiest. They can compare estrogen to anandamide, this happiness, this clear-headedness, and it starts to decrease in a point where the progesterone, another hormone, kicks in, and that's there to, I won't go too far in it, but they work with each other to get rid of the lining and for bleeding. But when that progesterone kicks on, the estrogen goes down, you notice a difference in the way that the cannabinoids affect you. Sometimes people have a stronger response to cannabinoids during their period. And when I say their period, I'm saying when they're bleeding, like right before the PMS and the period. And they've shown that the plasma levels are usually a little higher. I'm going to say these are for more normal periods and PMS, not the light period, but plasma levels are a little higher. And so your body has more hormones and receptors, more plasma, more receptors for the cannabinoids to bind onto. So it may feel a little stronger at that time. So I'll have patients who they're not even taking cannabinoids for their menstrual cycle. They're taking them for something else, whether it's anxiety, depression, pain, cancer. And we found a happy place. We call it your optimum dosing range. And so we find the right cannabinoid cocktail modality and what's perfect for them day to day to have a healthy or a quality of life. But then they get their period, and now I'll get an email or a call saying, "Whoa, it seems really strong today." And I'm like, "Oh," and I'll go through my list. I'm like, "Wait, are you on your period?" And like, "Yes." I'm like, "Okay, so you're one that your hormones are up, and it's creating the cannabinoid efficacy to be more enhanced because of more receptors." So then I'll have them drop back their dose, and then when their period is over, when the bleeding is done, then go back up to their optimal dose. So it's that fluctuation in hormones and the plasma and the receptors that increases or decreases the effects of cannabinoids in your system. So knowing yourself and really listening to your body, and not just physical. We're not just talking about pain or cramps or backaches. We're talking about the emotional, the anxiety, the happy, the brain fog, cognitive, everything together play in our endocannabinoid system, because we have, whether we're working on your serotonin or dopamine receptors, or we're working on your pain, your TPRV, one or certain receptors that cause pain. So cannabinoids interact with all those receptors. So it's the whole body. We have to listen to ourselves and then judge that during our period if we need to go up or down, depending on what kind of cycle we have.
So let me do a little recap.
Sorry.
Because like we're learning so many new things. Right? These are things that we all have never learned before. So at the highest level, the way our body processes cannabinoids got nothing to do with height and weight and all these kind of more physical things. It's a lot more to do with hormones, the general state of your own endocannabinoid system, your diet, and all these things, right?
Correct.
And that our own tolerance changes throughout our different parts of our own cycle, right? And so what is a good dose or a good profile for us in one phase may be very different in another phase, and so that requires us to be super aware of like what is changing so that we can
Yes.
adapt it. Okay.
Correct.
I think those were the key. All right. So maybe next, and everybody listening in today, please chime in with questions in the chat if you have any, and we'll address those as we go. But I think the next thing we could do is let's just kind of step into the stages now, and maybe we start with PMS because that's kind
Yes.
of like chronologically kind of how we think about oh something is off or different, and so you know during PMS, like what is going on in our systems, and then a second layer onto that is all right, and then how can cannabinoids kind of help with
With the
some
PMS.
yeah
So, and you know, PMS, again, it's some people have very severe PMS. Some people just have normal, you know, cramps and headaches or migraines. Some don't have any, and I'm jealous of you people. But, so, and the other thing is, I want to backtrack is when we talk about PMS, the menstrual cycle, the science behind everything is still limited. We still, even hormonal migraines, we still don't know exactly why we have them and how to treat. I mean, they really haven't, the research is not there as much as it should be. We should be knowing so much more about women's health and, you know, PMS and menstrual cycle, endometriosis, hormonal migraines, all these things, you know, it leads to IBS. They should be studied so we can understand it and deal with it, but it's still not out there. So understanding how cannabinoids interact during these times is still, we know what we do know about, you know, the anti-inflammatory properties, the, you know, analgesic and anti-anxiety, but we don't always know exactly which receptor they're hitting because we don't understand the symptoms themselves or, you know, how they're general coming around. Yeah. So PMS, now typical symptoms, you know, so we get that hormonal migraine before, the cramping may start, or some IBS, I call it IBS, but it could be constipation, diarrhea, digestion issues. So people start to get that body ache. They feel like they're getting the flu, and they're like, am I getting the flu? And it ends up, it's just the precursor to their period. The other thing is that bloating may start. Some people get the bloating. Some people will, you know, already get like the pelvic floor cramp down there, kind of by your femoral artery or in your lower hips. Sorry. So these things start to kick in. A lot of people think they're getting the flu and they're not sure what's going on, but this is just how the body is responding to this hormonal shift in their body. And again, you know, our period, this is just like we think of the gut-brain axis. It's the same with our periods. Our brain is interacting with our uterus, but also our gut, because our gut is stimulated from that as well. So anxiety starts to go up. You know, some people start to get a little more lethargic and irritable. So these are these emotional aspects. So what we're thinking is, with the phases in your menstrual cycle, this is where your body's own hormones are starting to fluctuate, because the first part, after you're done bleeding, estrogen starts to build up, and the estrogen in your body is building up because it's trying to thicken the lining of the uterus. So as it's thickening that line, the estrogen is coming up high, and usually people feel pretty good. That's where they feel happy. That's similar to the anandamide, you know, endogenous cannabinoid. So
is there what is the relationship between estrogen and anandamide?
They think it increases the production of anandamide, and it's similar properties where it's they say women, this would be like where they're their happiest and they're most motivated and non-anxieties when their estrogen levels are high. It decreases the possibility, they think, you know, you have less headaches when your estrogen is high. So that's, you know, your skin is better when your estrogen is high. So this is that part. And then the estrogen starts to drop down and progesterone is kicking in. So progesterone is also a smooth muscle relaxer. So it's there to help decrease the contractions and the smooth muscle relaxer. For some people, if they're low on progesterone, the cramps can get harder. You know, they're more constricting. The other problem is people have too high progesterone. The smooth muscle relaxer stops your gut. You know, the motility in your gut, the colon is not spasming with intestines, so they're not moving things through. So then you can get constipation. So But again, this depends on your specific levels of hormone adjustment during your periods. Some of us have very severe hormone shifts, and so it can cause, almost a diarrhea, or, that's where we see IBS, because it's like a back and forth of constipation and diarrhea. And that has to do with your progesterone and then your prostaglandin, which kicks in after the progesterone. It's another hormone that we secrete that helps. So the estrogen's kicked in. I went too far ahead of myself here. It builds the lining of the uterus, and it does that so that if you want to get pregnant, an egg can come out the fallopian tubes and stick to the wall and create the pregnancy. Now, the thing is, I'll go for that later. I was going to talk about endometriosis, but
yeah, let's definitely address that later.
Okay.
Yeah.
So that thickens, and so that's happening, and you don't get pregnant. So now that lining comes down. This is where the progesterone kicks in, and it starts to decrease the lining, and as that goes down, there's the other one called prostaglandin, and that helps the kind of the shedding of the lining. That's where the bleeding comes in.
So does PMS kind of get triggered when the estrogen starts to go down?
Yeah. So it's that level, kind of the roller coaster. Yeah, they're crossing paths. And that's where, you're losing that estrogen, and you're increasing that progesterone. So the gut starts to be stimulated, whether it's too much or too little. This is where the migraines kick in. So you'll see some, if you go to your OBGYN, because you have hormonal migraines. Now, hormonal migraines are different than other migraines. This is not a pressure, sinus, headache, or migraine. This hormonal migraines are different. We're not sure if it's something to do with the TPRV1 receptor, which is a pain receptor in the brain, if that's being stimulated, or is it vasoconstriction that's causing the migraine? So, but it's definitely a hormonal shift. We know it's related to the hormones. We're just not sure exactly what it's causing in the head to cause that migraine. So some people will be put on birth control with a high progesterone birth control. And so that's to increase the progesterone, so that will help decrease your cramping and decrease hormonal migraines. So during this, if you don't have access to birth control, or you have, certain people like myself who high risk of stroke, so they won't put you on the birth control anymore. You have to find something else. And sometimes it's those hormonal migraines, you can't capture them with your basic over-the-counter meds. So we have found that CBG, cannabidiol, stem cell of the cannabis plant, it's a vasodilator. We also know that CBG.
Can you break down what vasodilator means to those of us?
Yeah, sorry. So it just sounds like dilation. So it's So it's when we're trying to figure out, is it vasoconstriction? So that's the veins or the arteries. They're tightening. They're constricting, like spasming. So is that what is causing the hormonal migraine? Not sure. Again, I'm not sure. But the CBG cannabidiol dilates it, so it relaxes that spasm. It opens it and dilates it. So a dilation of blood flow.
Okay. And so from a layman's point of view, they have found that the CBG can help with just your better blood flow.
Yes.
Okay. Yes. Which then can impact things like migraines and
hypertension. If your blood pressure is up, bringing it down. And that's the other thing, with hormones, is your blood pressure up? Are you agitated? Is it vasoconstriction, vasodilation? Or some people are on meds for calming anxiety, and they talk about vasodilation, or the blood pressure, decreasing your blood pressure, bringing it down. So CBG is similar in that aspect. But also the other part of we're trying to figure out, is it the TPRV1 receptor? So these are your vanilloid receptors. These are pain receptors. People think of them as the hot, or the spicy receptor, or when somebody it feels like a bee sting on your finger. It's the nosy receptor there. So that sends a signal to your brain, the TPRV1 receptor, and tells you you're in pain. So CBD blocks that message. It oversensitizes the receptor and stops it from responding. So is that the other way?
Relieve pain.
Yeah, so it relieves pain. So it stops the message from getting to the point of the blocking the message plane. It's stopping the mail from getting there. So CBG also works with the TPRV1 receptor. So the combination of those two with hormonal migraines has been really beneficial. I mean, something I only use those now. When my hormonal migraines kick in, I go straight to I have a 1-to-1, the Daily Defense 1-to-1 CBD, CBG, and it's high. I mean, I do need a higher dose, 20, I'll take it every 6 hours just to get through the migraines. But before, nothing would stop a migraine. You go into a dark room and you'd be there for 3 or 4 days because you can't capture the pain. Well, again, hormonal migraines, and it's PMS related.
And do other cannabinoids like THC have a relationship to the hormonal migraines or things that are, triggered by changes in your hormones?
Yeah, so that's the other thing we notice is THC increases the intensity of a hormonal migraine. So if you're needing that THC, and I always treat THC as somebody who's similar to an anesthesiologist working in a hospital for so long. I relate him to medical, going in the OR. THC is my anesthesiologist. They're there to help me forget that I'm in pain. While on the table, the surgeon is my CBD and my nurse helping him is CBG, and they're working together to solve the problem, remove it, decrease inflammation or whatever's happening there. Well, anesthesia helps me forget. So sometimes that pain is so severe, even though it may enhance the effect or cause the throbbing to be more in a hormone. This is specific to hormonal migraines. As long as you can make sure you have a much higher potency of CBD, CBG to counteract that THC, you can still bring in that THC and help you forget that you're in pain, or at least be not caring about the pain at the moment while they're taking care of whether it's the vasodilation or stopping the TPRV1 receptor, or maybe it's an inflammatory response that they're stopping the cytokine release and build up. So I prefer working again the whole plant, putting everything together.
They're a teamwork.
And then terpenes. I also, if my migraine gets too severe, I will use, and again, this is just what I use and I refer my patients to, is the relief aid with the extra turmeric and ginger, because I can get nauseous with my headaches, and then the anti-inflammatories. So, and that bumps up my CBD a little bit more if I need some extra. So I'm all about combining everything I need and just finding the right numbers and ratios that will help with that specific symptom at the time.
And so let's talk about some of the other common things that we deal with, right? So the cramping.
Yes.
Right? And the physical kind of pain. Yes. I think in general, we know that, CBD and certain ratios are good for that. But is there anything specific about the type of like pelvic or abdominal cramping? And have you found certain profiles of cannabinoids that help with that?
Yeah. And so again, I tend to go to a high CBD, CBG with the low THC, because again, I want everything in there. And then if I need to add in the extra THC, I can, as long as my other ratios are high. So the cramping, we also know, so let's go to the digestive system when you're in PMS. So we have cramps. We have our bowel motilities decreasing or increasing depending on progesterone and prostaglandin levels in your cell. So we know that CBD is anti-inflammatory, but we also know that CBG is anti-inflammatory and is showing that it relaxes the smooth muscles almost even more and decreases spasming than the THC. These are new studies coming out. But we also know that CBG decreases, there's certain gases in your stomach that develop with the swelling and inflammation, like nitric oxide, and there's one that's COX1, but CBG decreases this byproduct. And so that decreases the swelling, the bloating, and then you have the constriction, so the cramping. So not only are we using them all for the anti-inflammatory, decreasing the cytokine release, which is that chemical your body releases to target a pain where the cramping and the pain kick in. So they're decreasing that signal, saying, hey, we don't need to increase our pain or inflammation. Let's bring that down. But also we're going to act as smooth muscle relaxers and decrease the spasming of the cramp, as well as if we're talking about our gut, we're working with decreasing nitric oxide and a COX1. So it's helping motility get going again. It's decreasing the bloating, that gas that was being released. And some people are constipated from too much progesterone, and some people are having the opposite of constipation from too little progesterone. So the CBD and CBG come in and help balance that spasming and inflammation in the gut and help things flow. As well as I always like to bring up that CBG helps with some of us that have had kids are a little, go to the bathroom quite a bit when we have to, for urine. So CBG also helps decrease the contractions in your bladder. So CBG is great for those of us who may have to run to the bathroom because we just thought about it. So it helps to decrease those. CBG is shown to help decrease those contractions in the bladder as well, which I don't know if everybody has that, but with that heavy pelvic floor feeling, PMS, that feels like pressure on your bladder. So that does help with that as well. So that's just the gut aspect.
Okay.
Then we think about the lower back pain, because while your ovaries back there, everybody thinks their ovaries are up, they're lower down by the pelvis, and you have that lower back pain as well as things building. So let's say you're somebody, we'll talk about endometriosis. That pain is going to be even more severe because of the scarring tissue. That CBG and CBD are helping decrease that inflammation and block. And the CBD is helping with any possible migration of that tissue, but decreasing the pain. It's help blocking the pain signals. It's not just about the gut. You're doing multitasking here.
Yeah. Okay. And then let's talk about mood and depression and anxiety, and that's already kind of a common reason why people use cannabinoids. but yeah, can you speak to like how you work with that aspect?
Yeah. So a lot of people they're here seeing me specifically for anxiety or depression or mood. So sometimes we have to up our cannabinoids during our cycle because of that hormonal fluctuation. But CBD and CBG work on our 5-HT1A or our serotonin receptors. So sometimes serotonin can drop during your menstrual cycle.
Is that another hormone?
Yes. Well, yes, it's a type of hormone. This is your endogenous, your cannabinoids that work from receptors. So the receptor is the 5-HT1A receptor, the serotonin receptor. The endogenous cannabinoid is serotonin. But we also have dopamine. Dopamine, is also a mood stabilizer. So CBG interacts with our dopamine to help bring that calmness. CBG is showing actually higher calmness than some CBD and THC. But again, this is individual, because when we talk about calmness and the different cannabinoids, somebody with severe anxiety is going to have a much different response to THC and even CBD, because CBD is biphasic and it's the dosing that, can really create that irritability or make it great.
Okay.
So knowing the individual is very important, because, somebody who has severe anxiety, they may have abnormally high cortisol levels because they're in that fight or flight all the time. And their serotonin and dopamine may be lower than normal. So you have to find a range. Hopefully we're already working together and we found the optimal dosing of CBD, CBG, THC, whichever one we're using or combination, so that when we get to PMS or a period, we probably are going to have to bring that up. Yeah, we're going to have to give you a higher dose, or maybe have a capsule that you take that maybe, along with your tincture, or if you're inhaling. This is where we do multiple modalities, because when we're talking about our cycle, there's multiple things, different parts of our body. And that's when we're the endocannabinoid system. It's all the different receptors. So when these hormones in our body are fluctuating, different receptors are responding. We introduce cannabinoids into our body. Those receptors are responding differently because of our hormone levels than they do normally on a day-to-day basis. So we have to adjust from there. But this is where, so say, I don't know if we can jump into endometriosis.
Yeah.
If you have endometriosis, as far as we know, again, it's not greatly studied, but what we know of the anatomy of the woman or the female reproductive is that, when normally that estrogen kicks in, and then we have the endometrial cells moving and building that lining of the wall. Well, with endometriosis, those cells don't leave the fallopian tubes. So you have your ovaries, then your fallopian tubes that go down to the uterus. So they get in there and they don't make it down, or they don't flush out. You don't bleed them. You shed them off. You're not bleeding
So
them.
They're supposed to kind of shed out, but they start to accumulate. Right?
Yeah. So they actually go backwards as a retrograde, or it's up, kind of reverse. Like they're going reverse up the fallopian tubes, out the ovaries, and attaching to other parts of your body, your organs, your pelvic, your pelvis. And so these cells, this tissue kind of reacts like a scar tissue. And so when your estrogen builds up again, are those cells coming back out and building up again, attaching to other organs. But then that progesterone and prostaglandin that are affecting the crampings, well, it's affecting that tissue out there too. So that's where the severe cramping, the lower back pain, the lower pelvic floor, that pain is out there. And so some women will go in and have surgery to go in and remove those endometrial cells, that tissue from the different organs. But it doesn't stop. It's going to continuously go as long as you're having your period until maybe you hit menopause or, perimenopause and then menopause. So it's never really gone. But the thing that I found with a lot of patients is most of them would use cannabis to deal with that pain, which is completely understandable. It does help the pain. But a lot of them would use super high THC. And so now the science is showing, and now we know with the endocannabinoid system, these different receptors, there's a certain receptor called GPR18. So that's the one down in by your pelvis and your uterus. But when you're having your period, it activates the migration of those endometrial cells. So that's when causing the spread of them to go out further to the different organs. So knowing that, we now know that THC activates that receptor, so it causes the spread. It increases the metastasis of those cells. However, we know that CBD stops that activation. If you have a high enough CBD, so far they've seen that it blocks the activation of the GPR18 from migrating those cells. So as long as, so what I do with my patients, so as long as you do them together, so you still want the THC to forget, and you still want it for the other properties, the relaxation, but you need that CBD and CBG again for other things. And this is where we need a higher ratio or cocktail profile of CBD to that THC to stop the effect of that THC activating that GPR18, therefore increasing the metastasis of the endometrial cells. So as long as you have, and I always say for safety, go a 3-to-1 ratio of CBD to THC versus, a 2-to-1 as low as I go, definitely not a 1-to-1 because you're not mitigating the effects of the THC. So a 3-to-1 to be safe if you have severe endometriosis, that you're not increasing the spread of those endometrial cells. And then you also have, that high dose of CBD, which is stopping the inflammation of those cells and the spasming. And so and the CBG in there to help to calm and again decrease the spasming of that tissue that's already out there. So it's important to know that if you have endometrial or endometriosis, I'll talk about my endometrial cancer patients, but endometriosis, that you understand that you have to have a ratio of higher CBD to THC.
Okay. We have a question about CBN.
Sure.
And while CBN is most often associated with kind of like helping with sleep, but does CBN play a role in kind of these other aspects of symptom management?
Yes. So
maybe we'll start with PMS since we're still
PMS. So let's just think about symptoms with PMS: anxiety, irritability, possibly breast pain because of the estrogen and the milk production wanting to happen, swelling of the breast, hormonal migraines, pelvic floor, IBS issues. A lot of people that anxiety kicks in, and some people get a little bit of insomnia at night as well. So this is where you incorporate the different cannabinoids for different symptoms, different parts of the day, make it all work for you. Some people will incorporate, if they don't get too sleepy from CBN, they can incorporate that instead of THC to help them just kind of relax if they're worried about their THC level compared to their CBD. The other one is to use CBN at night to relax, because then your brain isn't, if you're already anxious, you don't need to activate your brain like the THC we're activating. The CB1 receptor with the psychotropic, our brain is active. It's not great when you already have anxiety and then you're irritable from PMS and then you're trying to sleep and everything's going through your mind, what you got to do tomorrow. So too much. Yeah, too much. So that THC that's usually you're like, no big deal. I mix it with my CBD, so I'm, can sleep fine. But if it's too active and then you're not, you're constant, your brain is active. So you're not hitting REM sleep. You're getting constant interrupted sleep at night. So that's where we incorporate a CBN with our CBD and CBG. It helps us relax without being too active in our brain. So because it is a byproduct of THC. So this helps us in that relaxation, take about an hour before sleep. That way your body starts to relax a bit. Then you can go to bed with the CBD and CBG and everything else in your system and be able to actually hit REM sleep and sleep throughout the night. I prefer a tincture or capsule at night because then it lasts longer in your system. So you're getting a full night's sleep versus if you were to smoke it can wear up to 2 to 4 hours and then you're up again or you're interrupted sleep. So modality is very important for that part as well.
And I know scientifically we know even less about CBN.
Yeah.
right? But in general, we have the entourage effect principle where trace amounts of all these cannabinoids and flavonoids and terpenes help each other. But is there a reason why someone would want to kind of avoid CBN at this point, or
Um, I haven't had it. Some people do get sleepy is similar to THC. So during the day, they
so you
won't use it. Yeah.
yeah.
Um, I haven't found a need to avoid it. I haven't had anybody that avoided it except for maybe daytime use.
Okay, because of this, they felt the sedative kind of
Yeah,
effects.
yeah,
Okay.
because and it's not like it knocks you out. Like some people take THC and they feel like they knocked out. It's more of a relaxing. It's that calming of the body,
Mhm.
antispasming, the relaxing. It's not going to give you that psychotropic high like you're going to get with the THC unless you have a high amount with mixed with other
Yeah.
cannabinoids. But it's more of just a calming. But some people trace amounts is not going to put you to sleep, is not
Yeah.
going to relax you too much. But if you have a higher dose at night, that'll help
Yeah.
you relax for sleep. So it's just what are you using it for? But again, I'm all about the entourage effect and using all the cannabinoids together as well as the terpenes, whether I'm
Mhm.
liming and alpha pinene during the day or myrcene for pain, a higher myrcene which increases my THC potency for those, so it's putting all those pieces together. And for me, I may have said, at 20 milligrams 3 times a day of CBD, CBG, but it's still microdosing.
Mhm.
I'm not taking multiple hits off something. And I want to be able to function during the day and,
Yeah.
be able to still do my mom things or work with patients. So it's about quality of life. And at
Yeah.
night, then if I want to up it to
Mhm.
relax, I can do that as well. But it's CBN. I've not had patients. And again, this is all anecdotal. I don't
Yeah.
have a lot of in vivo and in vitro studies or human clinical trials to be sure. But no, I haven't really had any people have negative responses to CBN. Some people, when you ever think about kids with Benadryl,
Mhm.
some kids, most
Mhm.
kids, they go to sleep. Some kids get hyper from Benadryl.
Can have
So
like an opposite effect for
yeah,
sure.
opposite effect. So CBN may not help you calm down enough at night. You may have to be one of those. It's similar to the kids with Benadryl. So it's
Mhm.
knowing you individually and working with that person and finding
Yeah.
out how they responded to the different
Okay.
cannabinoids.
The last thing for PMS, and then we'll move on to menstruation, is fatigue. Which I don't know about you, but I just
Daily.
out. I mean, being a woman in this world is
Yes.
already very exhausting. But how do cannabinoids how can they help with fatigue at this phase?
Okay, so and this is where we're also bringing in terpenes or added
Or herbs?
Ayurvedics, but I
Yeah.
want to be clear on CBD. CBD is biphasic, and if we're taking somebody with anxiety, again, different.
What's the basic mean for those of us who are new to the term?
So it you respond at different doses, so it's dose
Okay.
dependent. So
Okay.
let's say I'm going to take someone with anxiety because they seem to have the strongest reactions to
Okay.
CBD because we're
Okay.
usually taking it, but we have to find the right dose. So low dose, like 5, 10, like could be like coffee, like you were alert, you're ready to go. That was fantastic.
Yeah.
Then you find this middle dose, and either you're right at the perfect where it's taking care of your anxiety, you're not
Okay.
feeling too hyper, you're not, it's not having any kind of effect to that
Yeah.
aspect. You go a little higher than that. There's about 4 ranges with somebody with anxiety. They get irritable. Someone with anxiety starts to get angry and irritable, and they're just like they can feel it. You become self-aware of it. You go
Okay.
higher, a high dose, that's going to put you to sleep. Now, this
Okay.
is the part where you'll 75, 100, 150, depending on the person, milligrams, that can knock you out and make you go to sleep. So that's what the biphasic means. It has different responses to different dose dependent to the person's receptors.
Even just with the same compound, but at different
Mhm.
dosages,
Just the
it can
different,
have
potencies.
opposite
Yeah.
effects. Yeah.
So it's learning that person what's happening in their body already, like where they're, we also, if somebody's coming to me, there's a dysfunction in their endocannabinoid system. Their endogenous cannabinoids are not balanced. That's why we're introducing cannabinoids to bring that homeostasis back. So that's where you find out that cortisol level, the acetylcholine, serotonin, dopamine, and that's where we're bringing in the CBD, CBG, all the other cannabinoids to bring those back to balance. So somebody with severe anxiety really responds to those different doses of CBD.
Yeah. So with fatigue, like, I mean, for when we talk about the Polite line, we have the Power Up formulation, which has intentional lower concentrations of CBD and CBG than say Relief Aid, which is for pain and inflammation, right? And so that's what you're talking about with the biphasic curve, right? Where you're intentionally using a lower dosage because that's gonna give you a different kind of effect
response. Yeah, your body's gonna respond differently. But then you're also playing with the Ayurvedics. There, you have the if it was a terpene, you'd say limonene and alpha pinene. This is the citrus. This is the wake. This is the up. Then you talk about the inflammation and pain. For calm, you have the turmeric, anti-inflammatory, and ginger, anti-nausea. The daily defense is the one that I take daily because of, sorry, my dog was snoring. I take it daily because my back from intubating patients, I have 2 discs that are torn and they get really swollen. So I take the CBG and CBD to help decrease that inflammation, and I don't need anything else anymore. I no more prednisone, no more other anti-inflammatories, but it also has ashwagandha in it. And the ashwagandha for me and for my PMS, some people in your PMS, your sex drive changes during PMS because of your hormones. So ashwagandha also increases, and it's been known to increase testosterone, but increase that sex drive. It also brings calmness for anxiety. So somebody who already has anxiety, then you're getting PMS and your anxiety is shooting up, your irritability, you're tired. You add in that CBD, CBG to take care of that anxiety, but then that ashwagandha is also helping with the anxiety. So then your gut, what's happening in my gut? Are you constipated or having other issues? The frankincense helps as well. So putting all these components together, or if you're looking at your terpenes, your beta-caryophyllene, the anti-inflammatory, great for cancer. Your myrcene is for pain. So it's putting all the pieces together and creating that specific cocktail for you. And then think of it as your medicine cabinet. Today my hormonal migraines are bad and my back pain. So I start adding in or upping my dose of CBD, CBG with maybe a little more THC because the pain's getting a little more severe. So have your medicine cabinet ready. Somebody who has the flu or is sick, they have Dayquil or NyQuil, and it's not just one drug. There's something in there for the cough, something in there antihistamine, there's something in there for the pain and the mucus production. So there's 4 different meds in there for one purpose. It's the same with the cannabinoids. They all serve purposes in different parts of your body, different receptors, different lymphatic nodes, hormone receptors. Clearing CBG has been shown to help brain fog and clear, and it's so even that, because I don't know about everybody else, but when I get PMSy, I get a little, I want to say spacey, forgetful. I just kind of zone out, and so the CBG helps clear that brain fog and helps me focus as well as the CBD. So all these aspects play together. Different parts of the body, cannabinoids have different reactions, even though they're all in the same say it's one receptor, they're all having different reactions to that receptor. So it's taking care of the whole body and knowing when to incorporate something else or a different cannabinoid to benefit that or decrease that symptom.
With something like fatigue, so I know when we talk about pain, I know you and Mary are clinical experts. You guys always talk about getting ahead of it, right? And kind of
capturing it.
Yeah. And so maybe if you know that you're going to have daily pain, you take it in the morning first thing, so that you're anticipating that. With fatigue, is it a similar dynamic where you should be anticipatory, or if it's not necessary, you wait, and then when you feel the slump, you use it to kind of perk yourself up? Or
I say you be on top of it, because it's just like you want to know what's coming. So if you know yourself and that's down the road, that usually happens with your period or your PMS, and or certain triggers, that's going to happen. Be on top of it, because you don't want that big shift in your body. You want to keep those levels balanced. So again, the cannabinoids are substituting for chemicals in our body that are off. There's that dysfunction. And so that's your endocannabinoid system dysfunction.
Supplementing.
So they're already supplementing and compensating for those shifts in your body. And if you're already taking them daily and what is the optimal dosing, and something's coming, get on it. Already start, because that way you're keeping that balance versus that hormone shift, and then you're trying to catch up. And I say capture. Capture means catch up or be at the right dosing.
Okay.
So if you know the pain's coming, why would you don't want to sit here and wait for that cytokine release or inflammatory response, or whether it's the, a TPRV1 with the hormonal migraine, start building up your cannabinoid level to stop the intensity of that
Okay.
possible pain or possible response. So you're just getting in front of it.
Preventative approach. Yeah.
Yes, be preventative, just like we're supposed to be, exercising and eating healthy for preventing, diseases down. Same with cannabinoids. Use them to prevent the symptoms. And then nowadays, I used to get hormonal migraines so severe that I would be out for 3 days in a dark room and couldn't do anything. And now I know when it's coming. I up my dose, and my migraines, if I get them now, are very minimal. I can function, I can go out, I can drive, pick up kids, do whatever I need to do, work with patients, because I'm already on top of it. I already found the level to capture and create that balance. And then I know the level to bring it up to stop it from trying to spike. So that's where your pain spike. And that's another thing, as I tell patients, is this is not a once a day dosing or taking of a thing. This is something you should be taking all day. You want a constant level of cannabinoids in your system to create that balance. But then when you know something's coming, you want to up it. So morning, if you have something in there, it starts to wane. The cannabinoids start to decrease from your body. You need to keep it level. So at least 2 to 3 times a day, you should be taking your optimal dose range to keep that constant level in your system. And then while you're sleeping, and when you do that and you get your CBD and CBG, getting all your other, your levels in your body, endogenous cannabinoids level, you'll notice that your sleep cycle starts to get back on track again. So this is where you're getting the acetylcholine, the dopamine, the serotonin, cortisol levels. Once those are balanced, the other things start to fall into place. We say a lot with patients, it's there's a group of different the cluster symptoms, because it's not just I can't sleep and insomnia. Something led to that, the anxiety in the day or the depression, which then leads to anxiety, not sleeping, and that leads so there was something else. So you capture one of those, usually you capture the whole picture.
We have another question here. Is there a general length of time that cannabinoids stay in the body?
Yes.
I know this relates to modality, but can you break that down for us?
So modalities are important. So modalities are how you take the cannabinoids. So you have inhalation, whether it's vape or smoke, that kicks in right away because it goes right to the blood, past the alveoli, out to the capillaries. So that kicks in about 10 minutes and only lasts maximum, if you're lucky, 4 hours. Then it's out. Then those effects wear off. That doesn't mean it's clear of your system for a drug test. I'm saying the effects have worn off. Then you go to a tincture. So that's a tincture you take sublingually or under your tongue and the mucous membranes, and absorbs in the mucous membranes and some of the capillaries, and you swallow. That can take about 20 minutes to 30 minutes to kick in, depending on the person and what they're eating, and you're not following it with water. And then that will last about 6 hours. So a tincture can last up to 6 hours. You take a capsule, so you're swallowing it, it's digesting, so it's got to go past the liver and first metabolism. So that can take almost 30 to an hour to kick in, but then that can last up to 8 hours. So it's really, and then there's topicals. Then you put the topical on, and you get that response immediately, but it does wear off, and it just is on the skin. If you're using a patch or why can I not think of it right now? The patch.
Transdermal.
Thank you, transdermal. Just see, I need some more CBG. So transdermal, that's holding in the product there, so that will last longer and continue to last, and that gets further towards the blood-brain barrier. But using all these together, or some people do suppositories, vaginal or anal, depending on what's happening. When you're talking about your period and your menstrual cycle, you want to get oral because you want to get into the your digestion, and you also want to get into lymphatic nodes. You want to get that part to help with the cytokine, but you also may say, if you have a migraine, maybe you're putting topical on the place of the migraine to get the outside. It can act like a lidocaine and numbing with the high CBD. Then some people will also use vaginal suppositories, whether they make their own or some people take the tincture, rub and put in there. It's acting like a topical, getting into that muscle and the mucous membranes down there and decreasing the pain and swelling at site. So it's getting multiple areas all at once to treat, again, the whole body. So modalities have different start times, and they have different shelf lives. We call them their half-life. So they have different shelf lives in your body. They last only so long in your body. So it's knowing all those. So if somebody has severe PMS, severe pain, They wake up with the bad cramps. They got to go to work. Maybe they do an inhaled, maybe they vape right then to get the instant response. Then they take a tincture right after because they know that vape's going to wear off. It's going to kick in and wear off, but then the tincture will be in. Then they got to work a 12-hour, work in the hospital, 12.5-hour shift. That tincture is not going to cut it all day. I maybe don't want to have my tincture with me at work. I'll have a capsule in my purse. So about 4 hours after the tincture, I'm going to take that capsule. So that'll kick in when the tincture wears off, but that'll get me home tonight. And then maybe tonight I take another tincture, or if the pain is severe, take a vape when I get home, take the tincture, till evening till I go to bed, and then take a capsule so that in the morning that'll wear off. So it's using
like a choreography too.
Yeah, it is. It's playing the parts to make sure you have that constant level and you're capturing any pain that may spike or come through there and make it so you have quality of life and you can function throughout the day and not be curled in a ball or, moaning in the room in the darkness because it's so painful. So it's, I use everything. I tell people it's not just one specific way. It's not one specific cannabinoid. Use everything to benefit your health and wellness and your quality of life.
Oh, my monitor went. Give me 1 second here. Okay,
No
there we
worries.
go.
We can hear you.
Can you see me?
You're frozen, but I can hear you.
Okay.
Oh, now it's just me.
Want to be.
There you are. You're back.
Everybody's time. I realized we're already at the hour. And
oh my gosh! Oh Lord, it's been an hour. I'm sorry, I went on tangents.
Don't apologize. It made me realize that we probably could have just had PMS be.
Oh my gosh! See, you got to bring me back from these tangents.
No, but I think that's what this is about. We never get to talk about these phases of our bodies in this much detail. So I actually think it's a wonderful thing. And maybe in our part 2, we can go a little bit deeper into menstruation, right? So maybe just as a quick conclusion to kind of transition a little bit into that phase, you talked about how during menstruation, right? Oftentimes the pattern that you see is people needing to actually reduce their dosage. Yeah. And so maybe if you could just spend like a couple of minutes talking about that pattern that you see, and then we'll save other details for a part 2.
Okay. So we'll just dive in that. I will get a person call me and they're like, Jess, all of a sudden this feels really strong. I don't know why these, all of a sudden my dose, I feel a little too strong. I'm like, wait. And I will ask basic questions, kind of like, okay, what am I missing? Was there something? I'm like, oh, are you on your period? And they're like, yes, I'm PMS. I'm like, okay, well, this has to do with the increase in estrogen in the plasma in your body. So it's the, I always try to figure out how to say this, but the blood cells or the plasma, the fluid in your body, sometimes you'll notice some people get swelling or edematous during your period, even though you bleed later, you think I should be anemic. Well, that increase in plasma and swelling increases the cannabinoid response. It like makes it stronger. It's like having more receptors in your body. So that lower dose is hitting more targets. And so it's it's enhancing the effects of the cannabinoids. So simple fix, just decrease your dose a little bit just during that period, so swelling goes down, and they don't even know why that happens, which is another frustrating thing. You ask, well, why is there a swelling? They don't know. So, but is it capillary permeability, which means like the capillaries are leaking, or is it just the increase in fluid? And is that because of the prostaglandin? They don't know. So, but we do know that if you do have that response, we just bring down your dose. And then when your period's over, we go back to the happy optimal dosing. So yes, that does happen to women. Again, I think this has to do with our hormones and having more receptors. So we, that fluctuation changes our dosing and our dosing response during that time.
Okay. There's so many more questions I'm gonna ask you, but we will save it for part 2. Okay. And I think we'll also get to tackle perimenopause, menopause, postmenopause in future sessions as well.
Oh, future sessions.
No, I think as a final question, what being as someone that has watched this industry evolve, right? Yeah. What are women's needs that are really being overlooked by our industry, that our industry actually needs to pay much more attention to?
I think this is the biggest one, is our reproductive health. I just, not even cannabinoids. People don't understand how much birth control affects. It has nothing to do with birth control. It has to do with our PMS symptoms, our IBS symptoms, our hormonal migraines. They don't find anything else. They don't explain it. They don't educate it. And I feel reproductive health is a big one. They're getting better with cancers, with the female, breast cancers, ovarian, uterine. Again, that's for, knowing in the cannabinoid world or cannabis world that THC is not always our friend. I mean, I'm not saying it's not there. We're not bringing them in. We're just knowing how much of them we need to have there. And I think there's still a lot of myths out there, or no, the RSOs. People go to the RSOs because that's what used to be out there, and that works for a lot of cancers. But when it comes to females and reproductive cancers, we know that can cause metastasis because of things like the GPR18 receptor being activated and cause. So I feel that that's a big, that is still, to me, the most understudied, under researched, under mentioned. I feel like it's more word of mouth through women, learning from each other, than it is from those studies. And I was part of studies in the hospital when people were on the ventilators. We were doing different lung studies, and there was never really a study about women in my 22 years of working in the ICU and ER and NICU. There were studies on the babies and their hearts and their lungs and their kidneys, but the women, I just feel like we're really left out of this. So,
and we shouldn't. We're such a large part of the population, and so yeah, I think well, the solution is more of us being in this industry ourselves, right? And then more of us sharing the knowledge we have, and being advocates. But okay, I'm really looking forward to our next session. Thank you all who are still with us and who attended. If you have any questions for Jessica, please email them, or if you have future topics that you want to see covered, we're all ears, and we love learning together. So with that, thank you so much, Jessica. Such again, a wealth of knowledge and resources, and I'm always so excited to learn from you.
Yeah. Thank you for having me. I love educating. Get it out there. Tell everybody.
Yes, we will. We will continue to spread the word, and roll with all the changes that pop up.
Always evolving. Always new stuff out there. I'm always trying to learn what's out there and what we've figured out now. So yeah, always evolving.
All right. Well, thank you for everybody who participated, and we will see you next time.
Thank you.
Bye.